KZN Premier Sihle Zikalala is expected to assess the impact of COVID-19. This comes as number of infections are increasing in the province. Some communities still do not have access to proper sanitation and healthcare. The province has recorded more than 15,000 COVID-19 cases and 183 deaths. Tuba Vilani is following that story and joins us now. Tell us what it is that you are finding and expecting from today, Tuba.
Yes, good morning, Jane. We're coming to you live from eNcwavuma in the far northern KwaZulu-Natal at the Mosford Hospital. eNcwavuma, it's the bordering city to South Africa and Swaziland. And we understand that the Premier of the province has decided to visit this area, as we understand that the district of uMkhanyakude is bordering two neighboring countries, as I said, Swaziland and Mozambique. So they are expecting, or they are trying to deal with the cross-border infection. But he's here. He will donate equipment to this hospital in trying to assist the hospital to deal with this pandemic. But he will also, beside that, visit several households where he will be encouraging them to use the land that is available in this area for planting vegetables. Let me now speak to the Premier himself. Thank you so much, Premier. Just take us through about this program. One will say this is a very vulnerable province because of its location, the fact that it's bordering two neighboring countries.
Yes, this is one of the vulnerable areas bordering with two countries, Swaziland and Mozambique. And we are here to ensure that we assess the state of readiness for us as government to deal with COVID cases that may emerge as we go forward. And we are here to donate the equipment, the fridges, microwaves and all others which have been donated to us by DeFi, which emphasize the public-private partnership which we always talk about. And lastly, we will be encouraging people to continue planting one home, one garden, one home, one fruit tree, and that's what we'll be doing in this area.
Premier, the issue, as we are talking about the fact that the district is bordering two neighboring countries, how do we ensure that? We know that the borders are closed, but people are able to walk in and at any time across the border. In fact, they are accessing services across these countries.
Yes, that then poses a challenge because most of the people will come illegally, coming from Mozambique, coming to South Africa or Swaziland without going through the border. And that talks to us as government that we need to ensure that we continue to improve the fencing in this site, and we have spoken to the national government about that. But so far, the rate of infection is not bad in this area, and we've managed to contain it to a lower level through ensuring contact tracing and attending to those who are infected.
Thank you so much, Premier. That was the Premier of the province, Sihle Zikalala, is talking about one key issue, that is the fact that people from these neighboring countries are able to walk just across the fence to South Africa. And some of their basic services, they get them here in South Africa. Even people from here in eNcwavuma, some of them, they went to a nearby city in Swaziland for their daily shopping, which makes it easy for infections to cross the countries and affect people from each country.
Tuba, thank you for that.